Yeah, so welcome to our next session. In this session, we will talk more about the contribution of modern medicine, the contribution of Ayurveda, and how lifestyle changes basically helps in diabetes management. And we'll be taking more questions from the audience itself. So I will come back to Dr. Sangeetam and would like to have a quick insight that how Ayurveda has changed the whole aspects of diabetes and what are the contribution uh, has made to the lifestyle of the people.
Uh, so, Coming to this, Ayurveda management is already I told about like that we need to take some medications like the herbal preparations, etc. Along with that, we need to do lifestyle changes, do exercise, and if the body, we need to tell like through dosha. If it more increase, we can do the shodhana therapy, just like panchakarma therapy also. So one of such shamana therapy or medicine we are normally taking is one of diabeton. Naturally, I am using. It's containing 13 medicines, different herbal preparations, herbal medicine including that. That is a powder form, and what it is doing like that, it containing so much fiber-rich medicines. So after we taking that medicine, it go into our stomach and it started to expand. That it give the fullness in our mind. We are taking so it reduce the like reduce the not reduce the appetite. It reduce the feeling for taking so much food. So we take only very less medicine, and also because of that. During diabetes, the main problem is so many people is affecting with the constipation. So through this medicine, they increase the our digestion. Along with that, it emptying, clearing of the our stomach also doing because of that. It containing rich fiber. So also it contains so many medicines, herbal medicines. It reduce the glucose level in our body. Also, it support the insulin intake, no glucose intake by the insulin. That is, it reduce the insulin resistance in our body. So by that, it reduce the glucose level in our body from the first day only. After taking these medicines, we need to regularly check up every month so we can see that the effect like that from the first week or second week we can see the result like it controls our glucose level in our body, and it reduce our fatigue in our body. Gives some energy to do the exercise or daily activities. It improve our daily life like that, and it also reduces the complications in our body. By giving immunity, by supporting the increase the circulation in our body. So complications just like itching, pain in the body, joint pains, etc., it reduces our body. It gives so much energy to do the all work in daily life. So this is one of the best medicine I am normally using for diabetes. Uh, this is the method we are using. This is the management we are going like we are using the medicine for diabetes. Based on these factors, which reduce the glucose level, which increase reduce their feeling for eating. That is polyphagia. We are calling like normal diabetic people have so much attraction towards the food. How they need to take so much food like that, but normally they don't have that much appetite, but they are more attracted towards the food, and they started to take so much food. So it reduced all these things, and increase our digestion. So properly conversion of glucose, and also insulin intake also it will increase. Like that we normally do in Ayurveda.
Right. So great. So Dr. Preeti, I would like to take a quick insight from you. When a patient or starts No, the treatment of diabetes. There are certain complications, right, which he or she faces initially itself. So, what are those complications, and what should one do, to overcome those complications itself?
Okay, so diabetes actually is a anabolic disease, which means initially the weight of the patient will, I mean, will keep on increasing because now once a doctor puts the patient on a certain medication, the complications are either the weight might start dropping, decreasing a lot, or it might increase. So, again, you need to check on these factors and keep on visiting your physician because they know what to change next. Some of the diabetes medicines, they also lead to some fungal infections, so the hygiene should be good. People need to be watchful of high sugar levels in the urine because it secretes from the urine as well, which is why some of the fungal infections can happen in the private parts. So they need to be very watchful and keep in touch with your physician. We should not assume that, we are not doing good with the medicine, now we should switch on to another physician. That's again a myth. Okay, so yeah. Otherwise, as in other complications of the medicines, there aren't much.
Okay,
Yeah.
great. So we are moving towards our last session, basically, and that will be, we will be welcoming, thanking to our panelists out there, and we'll be taking few more questions, just one question each panelist, and then we will be winding up this webinar out there. I hope it is going pretty insightful for our audience. So meet us in the next session in next 20 seconds.